This is Ideal Health Solutions, the podcast with Dr. Timothy L. Brown.
All right, welcome to the Ideal Health Solutions, the podcast, the show where we explore innovations, challenges, and stories shaping the future of healthcare. I'm Dr. Timothy Brown, your host. Today's episode is one that will resonate with many or anyone across working in medicine or in healthcare leadership. We're diving into a topic that is too often lives in the shadows. That topic, which is burnout. But not just burnout today. We're also going to talk about breakthrough. My guest today is Dr. Gregory Charlop, also known as Dr. Greg, national speaker, wellness advocate, and author of the Physician Wellness Project, a doctor's roadmap to job satisfaction. He's passionate about helping physicians reclaim joy, purpose, in their life. And he brings decades of wisdom to the conversation. So whether you're a physician, executive, or simply someone striving to lead with empathy, this episode is for you. Let's get into it today. All right, so Dr. Greg, welcome to the show. It's a pleasure to have you join us on Ideal Health Solutions, the podcast.
Yeah, it's great to be here. You know, it's funny when you did that introduction and you mentioned the decades of experience, I was embarrassed. I didn't realize how much time has flown already. It almost hurts to hear that.
No, I totally understand. But, it's wisdom, so it's not a negative thing. It's like, I've been in the game a while, but I can share what I've learned and definitely help others as they're making that stride forward. All right, so I love to start talking about what you're seeing right now at work. What's keeping physicians and healthcare leaders alike up at night when it comes to burnout and well-being, from your perspective?
Well, I'll be candid. It's a lot of things, and there's a new sort of menace on the horizon, which is artificial intelligence, which is obviously not something that was in my book. It's kind of new to the scene, but before artificial intelligence, I think there were a lot of things that were really causing astronomical rates of burnout. I mean, we've been suffering from physician burnout, nurse burnout, pretty much everyone in healthcare, even administrations, been burned out. And this has been going on for years. And I think for a lot of the time it was that people are working hard. They are really, I think, overworked frequently. They're having to see more and more patients in less and less time. And I think for many people, the reason you went into healthcare is to help people. And when you feel really rushed and it becomes sort of this assembly line thing, what ends up happening is it takes away the one main source of joy that a lot of people would have in medicine. The reason you go in, you want to talk to people, you want to help them. And when people are just in and out, it becomes like a factory job almost, except it's very high pressure. And then on top of that, several years ago, we had COVID. COVID was a huge catalyst for burnout for doctors and nurses. A lot of people retired, so the people that were left were working harder. People were worried because you saw patients that you couldn't help. You're worried because you might get infected. You're worried that you might bring it home to your family. And you're worried because there wasn't the right equipment. A lot of hospitals couldn't get masks. They couldn't get this. They couldn't get that.
Correct.
And so I think COVID helped accelerate what was already happening, which is just this astronomical rate of physician nurse burnout. And truthfully, and this is something we talk about in the book that I've seen, and maybe AI will change this aspect, maybe for the better. I don't know, but at least in the pre-AI era, one thing. This is funny. So this is actually my first physician burnout discussion that we've had since AI has really taken off. So I'm kind of working through this while we're talking, so it's kind of fun for me.
I love it.
But at least in the pre-AI era, one thing that's really changed is that the people that succeed in medicine and nursing, these are hardworking people. These are people that really could do anything. They're smart, they're hardworking, they're accomplished, they're goal-directed. They can do whatever they want. They chose to go into medicine, I think, for largely altruistic goals. And then if their expectations aren't met because they don't have the kind of genuine connection with people they expected, then there's often a lot of second guessing. Like, did I even choose the right career?
Absolutely.
What am I doing here?
I think that's important. I was actually having a conversation today with a healthcare leader who was working as a nurse at the time during COVID and literally said, I was burnt out which made me go back to school to get my MBA, and also she ended up getting her MHA at the same time. But it's the fear of, I know what I want to do in healthcare, and I really enjoy that patient care. However, I was just completely wiped out, and I still want to stay in healthcare. But literally, she said, I don't want to do that part of healthcare anymore. So I totally get that. It was a very difficult time, and I don't think we've gotten through that mentally as healthcare leaders. It was very challenging for our healthcare leaders and individuals that were working in patient care to just navigate day to day work. We're still seeing the effects of that today.
Yeah, and I think I really think, and the effects I think are going to be long term. Because I think it's shaken a lot of our views of how healthcare works in the
Hmm.
sense that we realize, number one, the system is more vulnerable than we thought it was. You can't take for
Absolutely.
granted you're going to get stuff. Number two, the people that are here, I think, are working harder because so many people retired or quit. And
Hmm.
so the ones that are still doing it are harder. And then I think this sort of culture we had of traveling, being a per diem,
Mm.
locum tenens, and I did that. So I'm not against it at all. But I think it changed the way we looked at things. Whereas in the past, you might think, well, I'm going to be with this institution for a long time. Now, a
Absolutely.
lot of people don't look at it that way anymore. I mean, I guess
Hmm.
that's true for a lot of fields, not just in healthcare. But I think the idea that we're all kind of standing on quicksand, and
Mm.
at any minute, like, our job could disappear, or a job could
Absolutely.
deteriorate, or we might leave because we don't want to be there anymore. It's created like less of a sense of permanence, I think, for many of us.
Absolutely. We're talking where in healthcare, you're used to hearing people say, I've been with the organization for 15, 20, 30 years. Now we're looking at, a stint of 3 to 5 years, and individuals are ready to make that transition to other healthcare organizations. And that's going to transition and change what the culture of your organization may ultimately feel like. So how do you adjust and adapt to that? And I think we're going to get into that conversation just a little bit deeper in just a second. But I know you're mentioning, and I also mentioned this earlier in the introduction, your book. Uh, and I want to go to that in just a second. But the book that you're referring to is the Physician Wellness Project. Is that correct? Tell us about, just the
Right.
overview of the book. And I have a picture of it up. We will be giving a copy away of the book as well. So stay tuned. Like, share, comment. That's how you're going to get hopefully entered into that overall drawing for the book. But we will be shipping that out to one lucky individual as they listen to today's episode. But tell us about the Physician
Yeah.
Wellness Project. How did that come about?
Yeah, I appreciate that. And it does, it says physician in the title, but really I think it largely could be applicable to nearly anyone in healthcare. And,
Mm-hmm.
it sort of walks through, number one, why we're so burnt out, which
Mm-hmm.
I think there are several sort of causes of it. And then some potential solutions in terms of how you can empower yourself to be better. But I think some of the real issues about why we're burnt out, especially doctors
Mm-hmm.
and nurses and highly trained professionals, audiologists, uh, physical therapists, what happens is you've got this long runway. So,
Mm-hmm.
you want to say you want to be a doctor or a CRNA or a nurse or whatever. You're choosing a career path that takes many years to achieve. And so you have to go to college, you have to go to this, you have to go to that, you have to go to
Mm-hmm.
all these years of training. And your peers, who may be, people you grew up with, you knew well, they go into something else and they're able to start working very quickly. They're
Correct.
making money quickly. They often have more free time than you do because they're going out to parties, they're socializing, they're
Mm-hmm.
getting married, they're doing everything. Whereas you're very focused on working and school.
Mm-hmm.
And you have to do that for many, many years. And so you're already kind of stuck in this sort of long pathway, this long runway to get into your healthcare field. And then what often happens is by the time you finally get there, you may find that it wasn't what you expected. Maybe
Absolutely.
you're working harder than you thought. Maybe you're making less money. Maybe you're seeing more patients than you expected. Maybe
Mm-hmm.
you thought that because you were this highly trained professional, you could live where you want to live, only to
Mm-hmm.
find out that the city you want to live in doesn't have any jobs for the type of thing you're trying to do. And you're thinking,
Correct.
well, I trained for 10 years and now I still can't even live where I want to live. And then you
Mm-hmm.
feel stuck because now you've put all this effort in. It's not always so easy to I know you brought up an example earlier of someone who retrained themselves, but it's not always so
Correct.
easy for people, once you're in your 30s, 40s, you've done all this training to go do something else. So people feel trapped. You feel
Absolutely.
trapped. And so I think that leads to a lot of burnout because it takes so long to get somewhere. And then if you're disillusioned with where you finally get, it's a problem.
Absolutely. Well, you opened the book up, I think, around that same topic of job dissatisfaction. Can you unpack the difference between simple dissatisfaction and full burnout, and why recognizing the difference between the two is so important?
I mean, look, I talk to a lot of people outside of healthcare. Hardly anyone is satisfied with their job. So I get that. It's very rare. Like you probably are like, well, you're satisfied with your job. If you hear someone say that, you either think they're lying to you or you want to do what they're doing, right? Because you
So
don't see
true.
that too often. So job dissatisfaction is usually, there's annoyances like maybe
Hmm.
you don't get along with a coworker, or perhaps it's very difficult to park where you work, or maybe
Hmm.
you have to go through a lot of traffic to get there, or you might be dissatisfied because maybe you're not making as much money as you want, or maybe you have to work some holidays where you'd rather not work. You get
Hmm.
dissatisfied from that. Burnout usually comes, it's usually attached with a loss of purpose or a sense of disillusionment.
Like
And I
that.
think that you see that more in sort of healthcare type fields than in most other things. Now,
Hmm.
in many fields, like let's say, I don't want to pick any field. So let's say a
Hmm.
non-healthcare field. I will use an example because I don't want
I
to piss
like it.
anyone off. But let's say non-healthcare field Y. All right, you're in field
Hmm.
Y. You went into it because you thought it was interesting. It paid pretty good money. You were good at it. Now you might be annoyed with it, but it's sort of a transactional thing for a lot of people. People go into healthcare, I think, because they feel that they're part of some greater purpose. They feel
Hmm.
that they're helping society, they're helping people in need, whether it's the elderly or kids or people having babies or whatever. And you get a sense of purpose from that. And
Hmm.
because of the sense of purpose, it's easier to deal with the slings and arrows of training. It's easier to put in perspective, well, I have to go through all this traffic to get here, but that's all right because I'm helping
Hmm.
people. I have to miss my daughter's ballet recital, but it's okay because I'm helping
Hmm.
someone in need. The problem is if something happens, some event happens where now you no longer feel like you're serving this purpose. You no longer feel like you're really helping people. Then you think, well, why the heck am I missing my daughter's ballet recital?
So true.
It's once the purpose has evaporated because you're disillusioned, then all those slings and arrows, the traffic, the weekends, the
Hmm.
this, that, it keeps causing you to question to yourself, why am I doing this?
That's so true. I think about just your analogy here, and I'm thinking sometimes we put others before us, especially in healthcare. That's one of the biggest things that I push for is care for the caregiver. We're so adamant about allowing the sacrifice of our individual circle for the greater good of others so that they can get to their inner circle. And I just wonder often how many recitals were missed so that someone else could get the care so that they can attend the recital. And then we look back on it sometimes and it really does just kind of make you scratch your head. But great point across the board. You described something else in your book that I want to talk about too, the medical school paradox. What do you mean by that, and how do those early ideas clash with the realities of overall practice?
Yeah, and this is a big problem, and I don't. I don't think this is adequately discussed. I
Hmm.
actually think I may have coined this concept, but it's an interesting one. And here's the idea: is to get into medical school, you need more than just good grades and good MCAT
Hmm.
scores, good test scores. You need more than just going to a good college. You have to have stuff about you that shows you're more than a bookworm and that you're this interesting person. And you're
Hmm.
even seeing this in all kinds of other health professions. So it's not even just medical school anymore. Nurses, PAs, they have a similar situation.
Correct.
These programs want people that are well-rounded, that are interesting, that are humanitarians, that bring more to the table than just good grades. And the
Hmm.
truth is that there's plenty of people with good grades, so they have the ability to be selective here.
Correct.
So they want people that do other things, maybe excellent chefs who have, done professional cooking training, or maybe professional violinists, or people that wrote novels, or people that started a philanthropic organization, people that have done
Mm-hmm.
exceptional things. And so they select for people like that because those people are more interesting. They're more intellectually diverse. They bring more to the table. They're not just bookworms.
Mm-hmm.
The problem, and I think that's good. I support that. I really think that's a great idea. I'm not in any way criticizing that. But the problem is that when you're in medical school, you don't have time to do those things. If you were the professional violinist, the professional chef, you started a charitable organization, when you're in medical school, you are working way too much. You're not able to do that stuff. After medical school, you have residency. When you're in residency, you're working even more, which they don't warn you about, by the way, before you go to medical school. You think, oh, you're just done with medical school and you're done. You're in residency, you're working even more. And then now, once you're done with residency, maybe you've got a fellowship, and then you're working.
Mm-hmm.
Now you're finally working, right? You've done with all of your training. Now you're working a lot. Oftentimes, you even have more call than you did as a resident.
Mm-hmm.
Now you're totally responsible, so you're under a lot of stress. And you're hitting the stage of life where it's getting to be the point when, if you want to get married or you want to have kids, you want to buy a house, you're kind of in that stage where, like, this is the time to do that. So what happens is you're attracting to medical school people with all these diverse interests and talents and things.
Mm-hmm.
But what you do then is you're putting them in the situation where they can't use those. You're bringing in the professional violinist, but that person doesn't have time to practice violin. And so, and they don't have time to, you're bringing in people that are starting a charitable organization. They don't have time to work on it, start it, do anything. And so people often get frustrated because you're bringing people in that have these sort of interests, but then you're putting them in a system that doesn't allow them to act on their interests.
Wow, that's so, and that's so amazing. I can see the parallels not only to being a physician, but to really any career that you go into, and you start to lose the person that you thought you were going to be, the professional violinist. For me, it was, I'm a bass player. You probably can't see it in here, but I have my basses hanging all on the wall. I'm like, when was the last time I actually had time to pick the bass up? But it's because you get into those careers, into the field, and a little piece of you starts to slowly drip away because they're training you to be the professional that you need to be for work, but in some ways kind of neglecting the person that you were, or that you brought into the organization to be yourself. And I want to talk a little bit about that as well, as far as culture and organizational barriers. So I appreciate that metaphor in your book about the bucket of crabs. I think that's one of the areas that you pulled out. That idea that sometimes the culture itself holds us down. Have you seen that play out among maybe physicians or even leadership teams across that you've worked with?
Yeah, so the crab thing, and I don't know, this might even be apocryphal. I don't know if this is actually even true, but I like it so much. I didn't want to research it because I didn't want to find it was false. But the concept is that, the sort of saying is, if you have a bucket of live crabs, why don't you need to put a lid on the bucket?
Yeah.
And the reason you don't need to do it is because if one crab tries to climb out of the bucket, the other crabs pull them back in.
That is good.
And so the crabs in the bucket pull anyone who tries to get out of the bucket out. Again, I don't know if it's actually true. If it's not true, don't tell me, because I like the concept. But so I think the idea here is, in healthcare, you see the same sort of thing, which is, imagine you're a doctor or a nurse or anyone in the healthcare field. You're working a lot. Your peers are working a lot. Everybody's kind of upset. Many people are disillusioned. People are burnt out. And you come up with some idea. Maybe you're just going to work part-time and do something else part-time. Maybe you're going to change fields. Maybe you're going to, I don't know, do some other interesting thing that other people aren't doing. Maybe you're applying for some leadership position that other people didn't think to apply for. Whatever it may be, what often happens, and I've seen this countless times, is other people, you would think they would support you, but they usually don't. And I don't know, truthfully, if that's like a conscious thing, like a conscious jealousy, or like a subconscious thing. But what ends up happening a lot of times is, you've worked hard, Sally's worked hard. You see Sally she's got some clever idea that you didn't think of. And now Sally's like lifting herself up, and intentionally or not, you try to bring her back down
Wow.
because
Mhm.
you don't want her to escape. You're thinking, well, if I have to deal with all this garbage, so should she. And you try to bring her down. And this happens a lot. I've heard a lot of stories of this. I'm sure sometimes it is intentional, sometimes it isn't, but it happens all the time. I think people think, well, if I had to go through, you could, you can tell you many times you'd hear this. If I had to go through this, you should have to go through this. If
That is
I
so
had to be
true.
on call, Thanksgiving and miss being with my kids or my
Mhm.
spouse, so should you. Who are you to not do that? And so the culture, rather than trying to raise people up or support people that are coming up with solutions, it often works the opposite way.
Absolutely. I think the hardest thing about that is having a leader with that mentality that, well, I had to go through it, so you're going to have to go through it as well. But you have the opportunity and the ability to change things. And that's why I always go to, as leaders, there were barriers that you had to go through that you could definitely move for your peers or for your counterparts that may be coming up behind you. So I encourage all leaders today, if you know of yourself that might be doing this or other leaders that are, using that barrel of crab mentality, do your best to change it and transition it because it makes it a little bit easier for those that are coming up as well.
Yeah, and I will admit, in some ways, this is a tricky problem to solve
Hmm.
because, on one hand, yeah, you want to empower people, but on the other hand, you also don't want to. You have to be cautious, and this is what you'll hear as a response to this.
Hmm.
You don't want to like enable entitlement or weakness. So,
Correct.
for example, say you're a doctor and you were on call every third night and you were working 100 hours a week in training, and
Hmm.
someone comes up who's in training after you and they're like, I don't want to be on call and I don't want to work nights and
Hmm.
I only want to work 40 hours a week. There is some justification in saying, well, listen, this is what needs to be done
Correct.
for you to get the training. Like, you have to put in enough hours. You have to see what happens at night. You need some continuity where you're with the patient, for 24 hours, maybe more, to see how they do. So I get that there's some tension with this. I think particularly
Hmm.
with trainees, but I think for people out of training, people that are
Hmm.
already trained, I wish that we could come together and support people who are looking for innovative ways of making life better.
Absolutely. And I love that clarification too, because there are going to be times where you just got to do the work. It's going to be a little bit hard. It's going to be difficult. And you just got to suck it up and just go to it. So I agree with you from the aspect that there will be times where, hey, the work is just going to be hard. However, if every day is hard, then there needs to be a conversation, I think, of where to maybe relieve some of the stress or tension or maybe there may be a better way to kind of overall do the work as well. So I want to throw a stat
Right.
at you, and then I want to get your thoughts on it. The American Medical Association recently reported that 45% of physicians experience at least one symptom of burnout. That's down from 63% a few years ago, but still a huge number. What do you think is working and what's not working, and how we're trying to address the overall crisis of burnout?
I mean, I do think the numbers are improving to some degree simply because we're moving away from COVID. And so
Mm-hmm.
that was just like hopefully
Yeah,
a once in
we're
a
gonna
generation problem
exactly.
that, even though I do think it'll have some long term effects, obviously we're still better out, years later than we were at the time. So,
I agree.
it makes sense that the numbers would improve. And I'm thankful for that. I do think that there are some things that are working in our favor. Like, I actually think in many ways, AI, which I do hope we'll talk about just because it's kind of a fun topic. I do
Sure.
think AI in some ways for existing physicians has been helpful and I think can reduce certain degrees of stress. Like, for example, I think the AI tools that listen, these sort of ambient tools where the doctor is talking to a patient or the nurse or anyone is talking to a patient, the thing is listening and then it makes notes, summary notes of the conversation.
Yeah.
Stuff like that is really, I think, a great anti-burnout tool.
Mm.
And I think it does two great things I really like. One is, if you remember in the pre AI days, you go speak to the doctor, you're looking at the doctor. Where's the doctor looking? They're
Yeah.
looking over to the side at their
At a
computer
computer
terminal,
screen.
right?
Yeah.
So that gives, not only does that give you an unsatisfied unsatisfying experience, but truthfully, it also gives the doctor an unsatisfying experience. Because remember, the doctor went into this because they wanted to interact with people, but what's happening is the doctor's hearing the people, but interacting with the computer.
Correct.
But the other thing is, what the doctor was doing is the doctor was taking that work frequently, whatever they didn't finish, home. A lot of doctors did this, and they would finish these notes at home. And often that was uncompensated, and it would cut into family time and everything else. And so maybe they were supposed to have an 8-hour day, but they still have an hour or 2 hours of paperwork at home. And so this really reduced it. For many people, it cut out a massive fraction of this. So it gave the doctors a better experience with patients, and it gave them less work to do at home. So I think in that sense, that's a great example of things that are actually helping. And I think a lot of doctors and other healthcare providers are very happy with this. Now, I think what we need to be careful about for the administrators who are listening to this is that you don't think, oh, this is great. The doctors have all this extra free time. We're going to have them see more patients.
Load them with more patients. Exactly.
And this is the danger. So if the doctor was seeing, just to make some number up, 6 patients an hour before, now what you're doing is the administrators are the ones cutting the check for this AI. You're thinking, okay, well, I'm cutting a check for this AI, so now I want the doctors to see 8 patients.
Correct.
Okay. Now, I understand the temptation. You think, well, I'm putting this investment, I want to see some return. But what the return on investment, I think, should be, number one, the doctors are getting a better experience. Number two, they're going to have a lower rate of burnout because they're happier and they're not taking work home. And I don't think the doctors ever should have had to take that work home anyways.
Correct. I wholeheartedly agree. A lot of the paperwork, and I think that's where some of the issues come with in the healthcare industry, is paperwork. And I get it. We have to record everything, but there are better ways to do a lot of the paperwork that we have. Even when it comes down to notes, I love what you talked about with the AI assistant. I do have questions. One question around AI that we're going to jump into in just a second, but having the virtual AI assistant that's able to record the notes so that you're not manually having to write things down. Of course, you can go back and check and make sure that everything is succinct. But a lot of those AI assistants do allow you to free your hands up so that you do have that face-to-face interaction. I can't tell you the number of times I've gone to the doctor's office and the physician may walk in the office, they'll shake your hand, and then they'll go sit right in front of a computer and they just want you to talk and spew out everything. And I think about individuals that don't feel comfortable going to the doctor's office. That is a huge and major turnoff, because you don't have that interaction with another human. You see them sit in front of a computer, then they get up and walk back out the room. That's just so disheartening that we have in the healthcare industry.
And the interesting thing, again, to sort of bring up AI as the counterpoint to this, is I think a lot of doctors are feeling that AI is sort of hot on their heels, that like people, that AI may be threatening their jobs, just like in other fields too. Obviously, it's not just medicine. You see it everywhere, of course.
Correct.
But as human doctors, we need to bring stuff to the table. I think this is true for every field, but we need to bring stuff to the table that justifies our existence. So I call them chit-chatty doctors. The doctors that basically the ones that talk to you and think and give an answer that's speaking. In other words, not ones that use their hands per se. So I'm not talking about surgeons, anesthesiologists, but like an internist, those types of infectious disease, that kind of thing. The chit-chatty doctors, a lot of what you're doing at some point, it can largely be done by AI. And if that isn't true now, it will eventually be true, where you have a medical record, you have labs, you have someone who's describing their situation, and then there's an output, which is take these pills, do this, do that. Now, in order to justify your existence and have people use you, instead of just going to some AI system, there has to be this human presence.
Correct.
The way you justify yourself is that you have this human connection with your patients, and the patients want to talk to a person rather than just get like a pill spat out to them. So I do think that AI not only enables you to speak more to your patients because of like the ambient recording thing we were talking about, but it almost requires you to do that more so you can continue to justify your existence in the system.
Absolutely. Well, I mean, that kind of answers the question. So I'll just re-ask it and ensure that you got the fullness around AI and shift gears into connecting that technology, artificial intelligence, and wellness. So there is a lot of buzz around AI and digital tools designed to reduce administrative burden. Some earlier studies have shown about 31% reduction in burnout with ambient documentation tools, which is what you kind of mentioned. How do you see that innovation? Or how do you see innovation as both a help and a potential hazard in that overall space? Because I think you mostly answered that question, but I just wanted to ask it formally so we had it.
Well, I think, the ambient thing I just is awesome. I totally support that. I do think it helps in other ways. It helps in, there are decision-making algorithms. There's
Mm-hmm.
ways where AI can comb through the medical record and detect things that you as a doctor might miss.
Mm-hmm.
In theory at least, the AI can incorporate all of the labs and all the x-rays and this and that. And especially for rare diagnoses, the AI could do a pretty good job of that, truthfully.
Mm-hmm.
And so the AI could help you with that. And the AI could also notice things that you might miss, like that someone didn't get, I mean, this has existed to some degree in medical records for a while, but, someone might
Mm-hmm.
not have gotten a vaccine, or maybe someone didn't fill their prescription, or you sent someone to get labs and there was a lab that was abnormal, but not one you were looking for,
Mm-hmm.
that it'll help bring to your attention. So I think the AI is good about giving you a more thorough evaluation of the patient, helping you not miss things, helping make unusual diagnoses, putting disparate pieces of information together. I think it's really good. I think the danger of AI is that number one, it could replace a lot of doctors. I really think,
Mm-hmm.
especially for some doctors like radiologists, eventually pathologists,
Mm-hmm.
maybe dermatologists to some degree, AI and the chit chatty doctors, AI is going to be a real threat. And
Mm-hmm.
I think the problem is, and this is because you have a diverse audience of different healthcare professionals listening to this show. If you're a healthcare administrator, I'm sure you're thinking to yourself, well, how could I offload more stuff to AI? How could I
So
have
true.
AI do more things? And so there's going to be a lot of temptation to have stuff that would have been done by higher paid professionals, whether it's the triage nurse,
Correct.
whether it's a doctor, whether it's some of the mid-level providers. This will affect a lot of people. Offloading that to AI, and you're going to be under a lot of pressure to do that because there's so much cost competition,
Mm-hmm.
and AI costs less generally than humans. So as a hospital administrator, you're going to be running into this balancing act where, on one hand, you want to use AI as much as possible to save money, and it might streamline things, and maybe satisfaction will go up. But on the other hand, you could alienate your staff, and
Mm-hmm.
you worry about the AI hallucinating or doing things that are just wacky.
Absolutely. I had a conversation that will be released soon. It'll be on the podcast talking about introducing different types of AI into the healthcare industry and how the closer you get to patient care, the longer it's going to take to kind of validify and allow it to actually do the jobs that we know that it can do because of the fear of things like hallucinations and offering up false results and things of that nature and thanking for the actual human portion of the physician. So I think for those minute areas such as like billing and administrative portions, you're going to see it probably introduced a lot quicker to kind of alleviate some of the stresses that we see that are burning people out. Hands-on situations where billing codes may be switched or transposing numbers. A lot of those errors will go down. It's going to help to overall alleviate those issues. But again, as you said, it could potentially alienate their overall experience, which is hands-on patient care, providing the best quality care. So there is going to be a balance that's needed in the future of introducing AI into healthcare industry that they continue to evolve and hopefully balance out to share the load of work that is for the patient and also for the employees as well. All right, Dr. Gray, this conversation has been going in a phenomenal direction. I want to transition now into practical strategies and hope. You emphasize in your book, do the research. I think we've heard that a number of times. Using evidence to take ownership of one's career path. How can busy clinicians realistically apply that advice when time and energy are already stretched thin, from your perspective?
Well, so I'll tell you, and this has been a pet peeve of mine. We hinted at this earlier, but I think for some reason we've decided that it's gauche, or it's
Mm-hmm.
uncivilized to talk about the lifestyle aspect of different healthcare careers.
Mm-hmm.
In other words, if you're going into something, the prevailing thought is you should do it because that's what you really want to do.
Right.
So if you're becoming a nurse or you're becoming a doctor, and then even within your specialty, you want to become a neurosurgeon, for example, the reason why you should do that is because that's what you really want to do and you're good at it. And it
Mm-hmm.
would just, it's, there's just been this culture that it's like almost offensive to talk about what
So
is the
true.
life like for that, in terms of call responsibility, hours, how
Mm-hmm.
hard it is to get a job, salary, everything else. And so what happens is we're shuttling all these people into these different healthcare fields, and they really don't know what they're getting into. They
Mm-hmm.
really don't know. And so, like we talked about earlier, you think, well, I want to be a pediatric neurosurgeon because that's super cool. Maybe you saw a surgery and you thought it was really interesting, and you like the brain, and maybe you know someone who had it, so you want to do it.
Mm-hmm.
It's almost considered inappropriate to say, look, it's a cool field and it's great, but not only do you have to go through this hellish 7, 8, 9 year training program, but when you're done, you're going to be on call wherever you go every other night, every third night.
Correct.
Most of those times you're going to be up the whole night. Yeah, you're going to make a lot of money, but you might be working 80, 90 hours a week. So on a per hour basis, it's not great. And you may not necessarily get a job where you want to live.
Mm-hmm.
If we talked about this earlier, but I just think this is a big deal, so I'll repeat it. If you say become a pediatric neurosurgeon and you have your heart set on living in San Francisco, for example,
Mm-hmm.
there's only even though it's a big city, there's only so many pediatric neurosurgeons they need there. Like they don't,
Correct.
if they have as many as they need, if you walk in the door, it's not going to work.
So
Either
true.
you won't be hired or you won't have enough patients, you have to do something else. So people think, well, I went through all this training, I did everything, and now I still can't live where I want to live or have the type of job that I want to have. And you maybe you want to work at a certain type of hospital, you're not going to be able to get that. So I
Mm-hmm.
think the problem is people don't know what they're in for, and for some reason we've decided it's unacceptable to discuss this. So one thing I would change, and I think this is an easy thing to change, is we should be more candid with people ahead of time. This is what you're in for, this is what's great about this is what's not great about this. Are you sure you still want to do it? Because I think a lot of us would be, but a lot of us are much more comfortable dealing with adversity if we knew that that adversity was there and we factored it in and we said, well, this is cool. We could do it anyway.
So
Like
true.
I I um I've lived in LA for many years. I'm from California. I've lived all over California. I'm in Georgia now, but
Okay.
like I like the beach. The beach is great. I love the warmth and I love the palm trees and everything. But the truth is, if you live in LA, unless you live right next to the beach, most people will rarely go to it.
Mm.
And the reason why is, again, unless you live right next to it, it could take you an hour, hour and a half to get there because of traffic. When you get there, you have to deal with parking and everything else. And so you're rarely going to go unless you've got like half or three-quarters of a day that you can commit to that project.
That's so
Now, if
true.
you know that and you're speaking to someone who's thinking about moving to LA because of the beach, it would be helpful for them to know, don't move to LA for the beach unless you're living right next to it. Because if going to the beach is really a big thing for you, if you're an hour, hour and a half away, you're just not going to go. So what we need to
Absolutely.
do is we need to be candid with people beforehand. And then if someone decides to go, they're making an informed choice, and they could do something that makes sense. What'll happen is if the person doesn't know that, they think, oh, I'm moving to LA because I want to go to the beach. They live an hour and a half away. They never go. Then they're going to think, well, why am I paying all this money in rent and doing everything else? And I'm still not going to the beach.
Absolutely. When you were talking about showing both the good and the bad area, it triggered something in my mind. I speak for the American College of Healthcare Executives, and I help with their Board of Governors exam. And I teach a section on human resources, and there's a particular term that we use called critical incidences during the performance evaluation method, and that's where we keep a record of both the good and the bad, the positive and the negative. And I don't know why it triggered that when you say, I need to know both the good and the bad, or if you want to, the top, the up, the great side, and then also the side that no one really wants to talk about, in order for me to have that full 360 perspective of, is this the right career for me? Because you would hate to put that much time and investment into a career only to get into it and see that the negative outweighs the good. And then now you're stuck in a career that you probably really don't want to be in. You just saw, the beautiful side of it and it looked great. But there's real work involved with that overall career. And I think that's necessary, not only at the early careers perspective, but even prior, probably before then, as you're selecting the overall path that you want to take for your career.
And I think, I think a lot of us, we're smart people, and I think that we could be clear-eyed about our strengths and weaknesses.
Mm-hmm.
Like, I'll use myself as an example. I'm a morning person.
Correct.
And I've always been, even in high school, it's funny, if I had a test or something, I'd get up at like 4 in the morning and study for it. Everybody else I knew, they'd stay up late. That's how I'm wired.
Same here.
And so, right. So the thing is that knowing of a certain career, for me, this played a role. Now, this won't be an issue for everybody, but for me, this was an issue. It makes sense for me to do something where I could do most of my work in the morning because that's when I'm best. If you forced me to do a career, or if I stumbled on a career without realizing where most of my work would be at night, because that's the way that job is,
Mm-hmm.
I would be miserable.
Yeah.
Because it just doesn't work with my strengths and weaknesses. Now, if you gave me a job where I had to start early, that's fine. I'm totally cool with that, But I would not like a job where I had to go late. And so, thankfully, in my case, I ended up going into a career where it was a morning-oriented thing. So that worked out for me. But it's stuff like that you take a little bit of self-reflection. You think, well, what am I good at? What am I not good at? Like you said, and then you try to match that against your healthcare career. Because the thing is, if you want to go into healthcare, there's a lot of ways to do that. You could, as you said, you could become administration, nurse, PA. You could become a physical therapist. There's all kinds of things. Within doctors, there's all kinds of specialties. There's research. So there's a lot of ways to be in healthcare, and it's worth kind of matching your strengths, weaknesses, and interests with the job you're targeting, especially since the runway for it is so long.
Absolutely. Wow. There's so many ways I can go with that overall conversation, but there are several pathways in healthcare. And here's the beautiful thing. If you can't find one, the spectrum across is so broad that you could probably create one for yourself in healthcare where you'd be happy. So just think outside the box when it comes out to your career. What exactly it is you want to do? What are your must-haves? What are you not willing to do? Because all of that should be factored into the conversation of building out your career as you're moving forward. You dedicate an entire chapter to making your clinical career work and careers beyond medicine. What guidance do you have for professionals who feel called to explore something different, but fear they're giving up on their identity?
Yeah. So first of all, I would say, especially if you're in a specialized field, like a specialized for medicine or nursing or something like that, I wouldn't jump to this decision quickly.
Correct.
And I wouldn't assume the grass is greener on the other side of the fence, which a lot of people do. And I would not, if you're a doctor, except in very rare circumstances, I wouldn't go to a different residency after you finished one to do something else, because I think that, in my experience, that rarely makes people happier. So I wouldn't do those things. But what I would do is, first of all, I would think, is there a way I could salvage what I'm doing now first before doing something else? And what I mean by that is there may be ways you could still do what you're doing, but tinker with it to make it better. And we talk a lot about this in the book, but if anyone comes to me and they say, I want to do a different career, I would first say, well, let's think, is there anything we can do to make your career now better? Because sometimes the thing that's bothering you may be solvable. So let's say that you're, whatever, a nurse, a doctor, you really don't like being on call. You really don't like working nights, and you're getting burnt out from it. There may be a way to stay doing the same type of job and somehow switch where you don't do nights.
Correct.
That might be working for a different company. That might be working maybe weekends during the day, and maybe you work Saturday, for example, but you give up your night shifts. There may be things that you could do. Maybe you take a little pay cut work nights. There are
Correct.
things you could do to optimize the job now without giving it up. Maybe you just have some really irritating coworkers and that's why you're unhappy. Well, maybe you should just switch and work for a different hospital or a different facility. Maybe you don't like being around like really acute settings.
Mm-hmm.
Let's say you're let's say you're a pediatrician. Maybe you could work at a different location, a different practice environment. You're an anesthesiologist. Maybe instead of working in a hospital, you work in an ambulatory surgery center.
Correct.
There so the first thing I would say, and maybe, this is something people don't think about enough, maybe you could just work part-time.
Yeah.
Maybe the problem is that you feel that you don't have time to get some of the other things you want done. Like you never get to have breakfast with your kids, or there's other things you need to do outside of healthcare you don't have time for. You might be able to solve that just by going part-time. You work 80%, something like that. You have a day a week off, and maybe that will give you what you need. So the first
Absolutely.
thing I would do whenever I talk to people is, can we make your existing job better?
Better.
Now,
That's
if
it.
we've talked about this and we just can't, you just really don't like what you're doing,
Mm-hmm.
then yeah, then I would say, okay, well, let's look at jobs outside healthcare. And the thing about being in healthcare is the skills you get from healthcare really can be quite useful in many non-healthcare related fields. And what
So
I mean
true.
by that is, if you've gone and you're a doctor, you're a nurse, you're a CRNA, a physical therapist, you've proven that you're smart, you've proven that you're hardworking, you can get stuff done, and you know medicine. And so if you decide to go do something else, like let's say you want to work for a startup, you want to work for a venture capital firm, you
Correct.
want to become a teacher, there's all kinds of stuff where people will automatically respect you and give you
For the work.
credit as being a smart, hardworking person. So it's actually quite easy to get those jobs if you want to do that, because you
Absolutely.
walk in the door with credibility. Now, I know a lot of people, they don't have any kind of degrees. They may be the smartest person in the world, but if they don't have that many degrees, if they walk in the door for a job interview, they have to prove themselves.
That's so true.
But if you're walking in the door with an advanced degree, you're given this sort of credibility just as soon as without doing anything at all, because you have those letters after your name. And
So
so
true.
finding other jobs in many ways is much easier for you than it would be for other people, because of your advanced training and the credibility you get with that. And so there's a lot of cool jobs, like I said, you could do, from teaching to being a consultant for venture capital firms, investment banking firms. There's a lot of startups. You could be a
Yeah.
consultant for AI firms now that are building
So
healthcare
true.
related products. So there's a million things you could do that would leverage your credibility, your knowledge, your work ethic, but do something different. And so I do think there's a lot of excitement. Now, the one tip I give to people, for vast majority of people, I would tell you, keep your certification up.
Absolutely.
So if you're a nurse or you're a doctor, and you're thinking, well, I don't like doing this anymore, I'm going to become a consultant, and I'm going to stop practicing medicine or nursing, I would strongly recommend, at least for a while, keep your certification up, because if you do and you don't like it, you can always go back to some sort of nursing or medical career. If you've kept up your certification, you've kept up your CEs and that sort of thing. If you give it up, if you let it go, then you've sort of burned a bridge. So I
Correct.
would be cautious about that.
I think that's excellent advice for anyone that may be in the midst of transitioning, thinking about transitioning, that keeping your certification up, thinking outside of the box, using your transferable skills to really hone in into the new career that you could definitely transition into, and maybe even be even happier having more freedom and time to do what it is you've been called to do. So I think that's excellent advice to give, Dr. Reg. You've
Mhm.
mentored so many professionals through transition and recovery. What are a few leadership lessons that you've learned about creating cultures and wellness and trust?
Well, one thing that I found is people do better if you're candid with them.
Mm,
And so I think where a lot of cultures have trouble is that there's a lot of secrecy. So
mm,
there's budget cuts, but they don't want to tell anyone because they're afraid of like dealing with it. Or there's going to be issues, and so administration sort of keeps that hidden because they don't want to alarm people beforehand. or they already know that someone's going to be let go or given a raise or something, and they keep this stuff hidden. I think that this distrust is a real problem, and I think that administration shouldn't do that. I also think, and
Absolutely.
this is an issue. You see, I didn't talk about this in the book, but you see this in healthcare. You see this almost everywhere else. A lot of cultural problems come from a limited number of sources in most places. So, in a
Mm,
lot of places, you've got one, two employees that are really obnoxious. They don't want to
mhm.
be there. They're angry. They're disillusioned. They're complaining all the time. And you try to placate them. Maybe you don't give them assignments because you don't want to upset them. Those people often can poison the well. So I think if you have, one or two people like that are just bitter and unhappy, I would talk to them because maybe you could solve whatever the problem is. But if you can't, keeping them around is in this. It's not. I don't think it's doing your organization any good because, like I said,
Absolutely.
it poisons the well for everybody else. But one other thing I just want to add, we didn't really talk about this too much, but I just want to say because I think it's so important. And this goes back to that medical school paradox thing you mentioned at the beginning, which is
Mhm,
if you can give people, and I talked about this at a few conferences, at the Houston Methodist conference, we talked about this, and at Opal, we talked about this.
mhm.
If you can give people a creative side project or a creative
That's
outlet,
good.
that really adds a lot of value to not only your organization, but to that person. So, what do I mean by that? Like, so again, you have these people that come in, doctors, nurses, they're multidimensional people, they're smart, they're creative, they want to do stuff. Now, let's say, you've got some doctors or nurses and they want to, create an art exhibit. Maybe they want to exhibit some of the patient's art in the surgical waiting room, or they like the idea of having a yoga Thursdays thing
That's
where they
awesome.
have yoga instructor come in, or maybe they want to have a food truck Wednesday,
Yeah.
or maybe they want to figure out some way that you could have healthy food for the staff that's working overnight. Like maybe you could bring in fresh salads or something, so they're not having to have sort of the garbage food. People want
Mhm.
to do these things,
They do.
and it makes people happy to do the stuff. And
Absolutely.
so I would say if you're in administration, you should try to empower people to do this. You should try to knock down barriers, maybe even give them a budget, give them free time. If you have nurses or doctors, they want to, set these things up, you should encourage them to do it and make it easier for them. Because what
That's right.
happens is you get two wins. Number one, those people are going to be happier. Like let's say you use the art exhibit example. And so they set up and they have patients' art, in the surgical waiting room. What do you think is going to happen every time that staff member walks through the surgical waiting room? They're
Mhm.
going to smile to
It's gonna
themselves and be like,
smile.
you know
Yeah.
what? I did that. They're going to feel good.
Absolutely.
That person's not quitting. That person's not
No.
getting burnt out because they're happy and they know they made a contribution. So they're making the system better and they're also making themselves happier. So, one thing I
Mm,
would just say is for the administration listening to this, find a way to allow your people, if they want to go above and beyond and have some sort of creative outlet that'll make the system better. And
mhm.
and if you need to give them some time or some money or whatever, or you need to help go to bat for them by knocking down some bureaucratic hurdles, do it.
Do it. That is absolutely amazing. Well, this has been amazing. I do want to ask you one more question, and then we'll transition out. I promise. From your tips, from your top tips and FAQs, what's one practice you'd encourage every listener to start today? Maybe something simple but powerful enough to start their own breakthrough.
Well, there's this sort of Stanford model of resilience. And so one of the things is your sort of environment, but one of
Mhm,
them is you. So I would say that for everybody listening to this today, you don't have too much control over your work environment, maybe you have some, but you have a lot of control over yourself. So one thing you should do is you should do things that optimize your own sort of performance and health. So you need to make sure you're getting enough sleep, you need to exercise, you need to
mhm,
make sure that you're getting morning sunlight. You need to make sure that you're spending time, social time with people that matter to you, friends, family, that sort of thing.
mhm,
Because if you do that, not only will you be healthier, you'll be happier, and you'll be more clear-headed about how to solve problems. So you can boost your own resilience with these types of things: mindfulness,
mhm.
meditation, social engagement. There's a lot of stuff you could do that has nothing to do with your work, but that will make work better because you've improved your mood and your mental health and your resilience.
That's amazing. Absolutely. Wholeheartedly agree with everything that you said, both throughout the entire show, but definitely for creating that mental wellness of maybe yoga, prayer, exercise, things of that nature that really help you kind of hone in internally, settle yourself, and then you're able to create a better environment around you and absolutely for your overall career as well. Thank you so much. Dr. Greg, tell us, where can we see you next? What's coming up for you? Speaking engagements, how can people connect with you?
So I do speak a lot at conferences. That's become one of my main things. I actually just finished my certification in lifestyle medicine. And I've been working, we didn't talk about this today, but I've been working in the longevity world for several years. So I help people and particularly organizations like family offices with longevity, lifestyle design, burnout, the kind of stuff we're talking about here. So I speak at a lot of conferences about this. I love that topic. There's a lot of cool sort of longevity things that have come down the pipeline recently that I'm very excited about. And so I've been working on that. In terms of reaching me, I do work with individual people on burnout. I also give talks. I love giving talks. I give executive presentations, and I can even help healthcare organizations deal with staff burnout and performance improvement. And the best way to reach me, my website, GregoryCharlopMD.com, GregoryCharlopMD.com. I'm also on X, Twitter, with the same handle, and LinkedIn. I'm pretty big on LinkedIn. So those are probably the best ways of finding me.
Absolutely. Well, look, if anyone's interested, definitely I'll put its website on the page as well. This has been an amazing conversation from burnout to breakthrough. Thank you so much, Dr. Greg, for your time today and just for being a part of the conversation. I cannot wait to share this with the masses. For anyone that is looking, we will be giving away a copy of Dr. Greg's book for today. So please, all you need to do is share the overall episode, and definitely put a comment in there letting us know maybe one thing that he said to inspire you. We're going to select that individual and we'll send you a link to be able to get a copy of his book for free just from the show. But thank you again, Dr. Greg, for your time today. This has been phenomenal.
Thanks for having me.
Absolutely. If you enjoyed today's episode, be sure to follow Ideal Health Solutions, the podcast, wherever you listen. You can also connect with me on LinkedIn for more insights on leadership, health, and transformation. Until next time, stay inspired, stay focused, and remember, even in uncertainty, there's opportunity.